Every year, millions of older adults fall, not during something dramatic, not during an emergency, but while walking to the bathroom, while stepping off a curb, while reaching for something familiar. And here's the part most people don't expect. One fall quietly doubles your risk of falling again. Not because you suddenly became careless, but because your body and your confidence changed. If you are over 65, or if you love someone who is, this is not just important, this is personal. More than 1 out of every 4 seniors falls each year, yet less than half ever tell their doctor. Why? Because many falls don't leave visible injuries, but they leave something else behind. Fear. Fear that slowly limits movement. Fear that quietly weakens muscles. Fear that increases the chance of the next fall. And that second fall is often the one that changes everything. My name is Dr. Ella. I share clear, evidence-based health guidance designed especially for older adults, not to scare you, but to help you stay healthy, independent, and confident in your daily life. Everything you'll hear today is grounded in well-established research, including guidance used by healthcare providers and senior health organizations. And if you stay with me to the end, you'll learn why falls actually happen, the hidden risk factors most people miss, and the small daily changes that dramatically lower fall risk. Part 1. You may wonder why falls increase with age. Falls are rarely caused by one thing. They usually happen because several small changes quietly add up. 1. Lower body weakness. As we age, muscles, especially in the legs and hips, lose strength if they aren't used regularly. Weak legs mean slower reaction time, trouble correcting a misstep, difficulty rising after sitting. 2. Balance and coordination changes. Balance is a system. It depends on vision, inner ear function, muscle strength, brain processing speed. When even one part weakens, stability suffers. 3. Vision changes. Poor depth perception, reduced contrast, glare sensitivity, all make uneven surfaces harder to judge. 4. Medications. Some medicines, including common ones, can affect balance. Sedatives, tranquilizers, antidepressants, some blood pressure or allergy medications. Even over-the-counter drugs can contribute. 5. Vitamin D deficiency. Vitamin D supports muscle strength, bone health, neuromuscular coordination. Low levels increase fall and fracture risk. Part 2. The seasonal trap most people ignore. Fall and winter quietly increase danger. Wet floors, rain-slicked sidewalks, poor lighting earlier in the evening, slower reflexes in colder weather. Inside the home, risks rise too. Rugs that shift, slippers without grip, dim hallways at night. Falls are not about clumsiness. They are about environment meeting vulnerability. Part 3. Warning signs you should never ignore. Pay attention if you notice holding on to walls or furniture while walking, hesitation before stairs, shuffling steps, avoiding certain rooms or activities. These are not normal aging. They are early warning signals. Part 4. What to do now if you have not fallen before. 1. Health check-ins. Has there been recent illness or weakness? When was the last eye exam? Have medications changed? 2. Medication review. A doctor or pharmacist can often adjust doses, switch medications, reduce side effects that may affect balance. 3. Home safety audit. Look for loose cords, they could be uneven floors, throw rugs, poor lighting, slippery bathroom surfaces. Small fixes prevent big consequences. 4. Assistive devices are not failure. Canes and walkers reduce fall risk. They do not increase dependence. Using one early preserves independence longer. If this information is helping you or someone you love, consider subscribing. This channel exists to share clear, practical health guidance that helps seniors stay safe, steady, and confident in their daily life. Part 5. What happens after a fall? About 37% of falls require medical care or limit activity. Falls can cause wrist, arm, and ankle fractures, hip fractures, head injuries, especially dangerous for those on blood thinners. But there's another consequence people don't talk about enough. The fear of falling cycle. A fall occurs, fear increases, activity decreases, muscles weaken, fall risk rises again. Breaking this cycle early is critical. Part 6. Simple daily habits that reduce fall risk. Gentle strength exercises for legs. Here are some gentle leg exercises you can do at home. 1. Sit to stand, chair rise. This is one of the most important strength movements for older adults. This strengthens the thighs, hips, and core. 2. Heel raises. This strengthens the calves and ankles, which help stabilize your steps, prevent tripping. 3. Seated leg extensions. 4. Standing side leg lifts. 5. Marching in place. Stop if you feel dizzy, short of breath, or unsteady. Consistency matters more than intensity. If you've fallen recently or have medical conditions, speak with a healthcare provider before starting. And next is adequate hydration. Proper footwear with grip. Regular sunlight exposure for vitamin D. Staying socially and physically engaged. Prevention is not extreme, it's consistent. Falling is not an inevitable part of aging. Most falls are preventable. Awareness, preparation, and small daily choices protect not just your body, but your independence. If you found this helpful, like this video, share it with someone who needs it, and subscribe for more clear, senior-focused health guidance. This is Dr. Ella, and I'll see you in the next video. Stay steady, stay confident, stay well.